Bonjour les amis. Alors, comme promis, je vous mets en ligne la conférence de Jean-Jacques Trochon qui a eu la gentillesse de m'accorder cette faveur. Alors, oui, vous le savez, on va essayer de développer, d'aider, de faire bouger. À deux, on est toujours plus fort que tout seul. À tout de suite.
So welcome in Gustave Roussy. Very happy to have this meeting here. It has been a great adventure to go to this meeting with Jean-Jacques, William Lee, and just want to give a few words of introduction. So this meeting was possible because of different people, but mostly Jean-Jacques Trochon was pushy enough to say, I think that we have to think cancer differently than we do so far. There are a lot of people who are working on alternatives to treat cancer, to prevent cancer. He has been, and he will tell you a few words after me, he has been through a lot of people working on cancer for his own purpose and also for making a lot of people participating. And he told me one day, I would love to have all these people working on different approach of cancer together in Gustave Roussy. And so we did it. Lex Egermont accepted it, and he will tell you a few words. It was also possible because of Air France and Accor support, who make travel, etc. possible, which was very unexpected at the beginning. But Jean-Jacques, once again, was strong enough to get this approval. And the idea about this meeting is really to be very flexible on the way we are going to do. So we had some changes in the program, so sorry for the last minute changes. But the idea is that a lot of people who are working on the different aspects of diet, etc., on cancer will be here. And we'll have time for roundtable discussion. Of course, everyone should be able to participate, so don't be shy. We have to really to discuss all together what we could do in the future to use this concept or not use this concept, to prove that this concept is true or not. So I hope this day will be fruitful for all of you. Some people are going to arrive during the next coming minutes and so. And with that, I want to give the microphone to Lex Egermont. So Lex is our director in Gustave Roussy. He was very enthusiastic when I spoke with him about this concept. He told me it's a hot topic. So happy to welcome those people in Gustave Roussy. And Lex, please.
Merci, Bernard. So good morning, everybody. Welcome to Gustave Roussy. Gives me a particular pleasure to see that we will have a conference on a topic that we never had a specific conference about. And I want to thank Jean-Jacques in particular. I was in the US these last few days and I missed your email, but I just want to make a little point about that because I read it this morning. I want to thank you for your email. It's a magnificent email. I'm not going to read it to you, but it shows what a person can do in terms of supporting a cause and thinking in a very innovative way to get people together at a site which is dedicated to innovation and access to innovation. So you must understand that Gustave Roussy, on the one hand, is the largest comprehensive cancer center in Europe, but that we have made it a point that everything is focused on innovation, is creating a program that is the largest in terms of bringing new treatments and access to new treatments to patients. In terms of early clinical trials in France, we actually take care of more than 50% for the whole country. So it has a national importance, what we have created at Gustave Roussy. Now, they say you are what you eat. And that's very true, because the largest part of the surface of our body that communicates with the environment is the small bowel. And so food and processed food is just one of the problems that we are dealing with in carcinogenesis and in programming our immune system. And that's what you will be talking about today, is how food intake and calorie restriction and fasting actually plays a very important role in how we are being programmed by our environment, and we can choose our environment. This is one of the few things we actually can choose. We can make a choice how we eat and what we eat and how this may help us to lead a healthier life. So in the Abruzzi in Italy, there are villages where there are more people who reach the age of 100 years than anywhere else in Europe. And when you look at those villages, it seems to be relatively simple. Apart from the fact that there's no air pollution, it's in particular the way they eat, and the way they eat only things that they grow around their villages. And that leads to two observations. Not only do these villages have more centenaire than anybody else in Europe, but also there is a surprisingly low incidence of Alzheimer's disease in these villages. So it's all true that you are what you eat. We just need to figure out how to do this. And since cancer is the result of not only genetic predisposition, but how we interact with our environment, this is a very timely topic, and I think it's wonderful that you all came to this conference and that you have dedicated discussions to evaluate and to discuss the research in this domain. So Jean-Jacques, thank you very much. Bernard, thank you very much. I think you're both enigmatic because you represent something that is very dear and crucial to practicing in oncology, and it's the relationship between patients and physicians. And I think in both domains you are examples of how fruitful this can be and how it can lead to new initiatives and new way of thinking. So Rethinking Cancer is the right title. And I think in a couple of years we will say, remember that we had this conference, because it spurred us on to do and launch a number of repurposing and refocusing research programs also on this aspect, and I hope it will be to the benefit of us all. Thank you very much.
So thank you very much, Lex. So I want to introduce Jean-Jacques. So Jean-Jacques Trochon, probably everyone knows Jean-Jacques. So Jean-Jacques is, first of all, he's a pilot on Air France, so he might make your flight easy someday. So if you hear that the commandant de bord is Jean-Jacques Trochon, go and ask him. And in addition to that, he had kidney cancer some years ago. That's why I met him. And he has an incredible enthusiasm, and he wants to take care of himself. He wants to know and understand his disease, to try to do his best to be cured. And so far, I hope he's cured. So I'm going to ask Jean-Jacques to say some words, because he was at the initiative of this meeting, and thanks to him, the meeting is here. So Jean-Jacques.
Bonjour, good morning everyone. I am so happy to be able to be standing here today for this incredible meeting. I'm just going to be very short, because it's not about me, it's about millions of people. We each have terrible stories to tell among our families. I must say I've been to hell and back more than once, actually 4 times. And at some stage I didn't think I was going to make it, but I was very, very fortunate to actually meet people like Bernard, who, like Lex, you just said, we have a very special, or we have to have, I think, a very special relationship between doctor and patient. And this all came from the fact that after long years of studies, of research myself, having the help of many doctors around, I came up with an idea to actually recenter the position of the patient in this fight against cancer, but against other illnesses as well. As you know, things are very simple to start with, and then cancer is a very complicated beast. But cancer specialists, doctors know about this much better than anybody else. Doctors are doing a wonderful job every day, and I see that. I see them work, and they look after the patients, and they worry about the patients. But I think if we can try to find causes that are but maybe more logical and simple to help maybe curing some of the early illnesses, we might get somewhere earlier than we think. As we know, about 100 years ago, human beings were eating about 2 kilograms of sugar per person and per year. That's 4 pounds per person and per year. We now have 80 kilograms per year per person. That's 40 times more. And I don't think the body is able to cope with this. Mitochondria is, are little, what do you call them, the machines that produce the energy are just overwhelmed with all of this. And then if you count the number of pesticides and herbicides, the French government, no more than 3 weeks ago, have been coming up, on the story about cancelling some of those things that are spread around. And it's not the first time. And, this whole thing together makes the body much more difficult to cope with illnesses than what it was about 100 years ago. They had other problems, but it is true what Lex just been saying, that in some part of the world, life is simple, and suddenly you see nothing of what we have to cope with in our modern societies. So I just had the idea, look, I'm a pilot, I fly airplanes every day, and or every month. If you stay within a certain area in a volume that is designed to fly the airplane, then the airplane is safe. If you go outside, you don't know what you do. So it's exactly the same logic that I started here. If you are going to try things that make no sense in this approach, you never know where you're going to go, and you've got risks of getting ill very quickly, and it's not going to get any better. But if you follow procedures and you listen to doctors, and doctors are willing to go an extra mile to understand things, then you stay within a volume of knowledge, and you know where you're going. So you get maybe a better chance to get going. I want to let the dream team that I got going, I call them the dream team, all these fantastic people that came from abroad. Bernard is part of it, Lex is part of it, all the doctors are part of it. What is important to understand is that young doctors nowadays are part of this whole family of people that we are, and they are going to be touched by illness. So it's important that everybody tries to find a different way to help what is already existing. Thank you very much for being here. The dream team must start. The dream team is what it is now, but the dream team must be the people all together. Millions of people must become the dream team all together with the doctors. Thank you very much. Let's get going. And it's beautiful.
The goal of the meeting is really, when I discuss with Jean-Jacques, is okay, the idea, the concept is absolutely beautiful, but we don't have so many evidence, clinical evidence that this concept is working in cancer. And the idea is to gather many of you who first have a rationale to these different approaches about treating cancer, but also some clinical experience. And the idea and the goal of this meeting and this day of work is really to put the evidence we have. And we have very good scientists who have worked on this concept, on different aspects of it. And also to have some clinical evidence, which are, of course, limited. We don't have big randomized studies so far. And the question is, can we do that? And what we should do. And that will be the end of the day to try to, all together, to build some things that we could do for the future. And that's really what we want to reach at the end of the day. And I want to thank everyone who came from the US, every part of the world, Germany, UK, France, of course, and happy to be here. Some of you are probably skeptical about what's going to come from this meeting. I don't know what's going to come, but I'm sure something nice will, at the end, be issued from this meeting. So we'll start with the first session, but some rationale we have, and we put here 4 speakers. The first one will be William Lee. So William is the president of the Angiogenesis Foundation, and he spent many, many years looking at angiogenesis, the way to improve angiogenesis. And as you know, angiogenesis is a very important part of cancer. We first met with William a long time ago when I first worked on angiogenesis by trying shark cartilage. So it was one of my first experience, a very interesting experience about trying to fight against angiogenesis by giving to patients shark cartilage extract. So it was a nice study. It was the first time we did an international study in kidney cancer. We turned out not to be positive, but it was the first step, and now we have anti-angiogenic drugs which work in kidney cancer and in other cancers here. So William is going to give a talk on different aspects on this one. Then we'll have Walter Longo, who is working both in Italy and in US, has dedicating a lot of time about fasting and what's the consequence of fasting. Then we'll have Dr. Hope, who is going to give a talk on the title has been changed a little bit because of some last-minute adaptation on cellular intravascular targeting agents, what we know about that. And then Thomas Seyfried will give another talk on press pulse on non-toxic therapeutic strategy for the metastatic resolution of cancer. So you can see different aspects. So we'll have the 4 talks, and then we'll ask the 4 speakers to come here, and we'll ask questions and try to see what's come here. So William, you're going to start.
Et voilà les amis, voilà la première de cette série Rethinking Cancer 2017. Merci les amis, à tout à l'heure.